Hi everyone, my name is Danielle. I go by Danny, or if you ask my coworkers, it's Danny P. P's added on because, well, there's two of us. I love to cook and I love to hike and I am an urban homesteader. I have chickens and I garden and I have dogs and I live smack dab in the middle of a city. I also like to travel and go places. A little bit of things that we're going to discuss in this video. We're going to discuss about some of the history of nursing. We're going to talk about the scope of practice of nursing, and we're going to talk about interprofessional relationships in nursing, and then we're going to talk about some engagement strategies in nursing. To start off with, we're going to talk about one of the historical figures of nursing. So most people, when we think about nursing, and you can ask almost every nurse who is some of the biggest nursing people in history, they're going to say Florence Nightingale. You might hear the name Clara Barton come out, the founder of the American Red Cross. You might hear some of the people who founded some of the nursing theories. But I want to talk about somebody who is making history right now as we speak, and her name is Jen Hamilton. Jen Hamilton is a registered nurse. She currently works in labor and delivery, and she's also worked in an emergency room setting and has her CEN. And she's recently published a book called Birth Vibes. Now, this book and the videos that she makes on social media teaches the public and teaches other nurses about advocacy for their patients and how to stand up for them and how to work together. Some of the biggest things that she promotes is advocacy and collaboration with other providers, and she's a real historical figure in the development of nursing. She really gets out there and teaches everyone and just emulates core nursing values. And with that, I have taken some of the things that she has taught about her advocacy and I've incorporated that into my practice. One of the things I love that she teaches is that she will always tell her patients that she's going to be upfront and honest with them. She's going to be, their person and advocate for them and tell them that, she's going to communicate with the provider for them and help work together for them. And one of the phrases that she uses with her patients is, "I got you." And I have incorporated that into my life in the emergency room setting. When patients come in and they're scared and they're worried, I tell them, I said, "I'm here for you. I've got you. I'm going to be watching you. I'm going to be doing all of whatever we're doing for them." I said, "This is all for you to make sure that you are okay." And whatever, I said, and if we find out that something's not, my job is to try and help get you there. And I tell them, I give that gentle reminder again, "I got you." And that's one of the phrases she uses with her patients, and I've definitely incorporated that into my patients. And then her goal of being this amazing advocate for her patients has really influenced me to be a fierce advocate for mine. I had a situation with a patient that I felt like was going to be discharged home, and I felt like it was unsafe. So I spoke up with the provider and I told him, based on my assessment, I said, "I'm looking at this patient." I said, "She has labored breathing when she's walking. She has use of accessory muscles. I could audibly hear her wheezing. She's not able to speak in full sentences. And she's having to stop when she walks to catch her breath." So the provider took my assessment and he was like, "Okay, well then what do you want me to do?" And I said, "Well, how about we try a duo nap with her?" So we gave her 2 duo naps and the patient's breathing drastically improved. She was able to speak in sentences. She was not using accessory muscles anymore, and we ended up being able to discharge her home. I was not going to let that patient go home because I felt like it was unsafe. And I'm so thankful that I stood up for her and got her the care that she needed. So the scope of practice of advanced practice nursing that I'm entering is I'm going to be a family nurse practitioner. So that works in the outpatient setting, works in primary care. They can work in specialty offices as well. And some of the core nursing beliefs of that is expert guidance. So teaching people, giving patients, expert advice, collaborating with other team members of interdisciplinary. For example, you might have to collaborate with a doctor, a cardiologist, an endocrinologist to help manage chronic illnesses for people. You might have to get, people involved such as physical therapy or occupational therapy, especially, if they've had a stroke or an injury. You might have to consult orthopedics. And all of these things that you have to do to collaborate, and then advocate for your patient, because if you're the primary care provider, you're the one who's trying to get, that holistic approach for them, and to get, your patient, if they have a chronic disease, managed well, or if they have some illness, to help get them better. Some of the patient populations that I will be serving, I will serve anywhere from birth to geriatrics. So a family nurse practitioner can serve all ages within that field. And advocating and delivering care that supports the practice at the full scope of education is extremely important in this field, because you're the one who is the center for managing the care for these patients. You're the one that's going to be that main advocate, that main person they come to manage their care. And so that's extremely important, because you want patients to have the best care possible. We're going to talk a little bit about some collaboration as well. So as a family nurse practitioner, you'll have to collaborate with others. And as a registered nurse, I've had to collaborate with other doctors and PAs, specifically in my role in urgent care, when we went around to different locations, and we were assessing our triage times and evaluating that and how we could improve that so that patients could be seen in a more timely manner and people didn't get missed. So we went around to different locations, assessed how everyone did it, and came up with a standardization that's more improved and more up to date on our triage policies for our patients, and ensuring that they get everything done and seen in a timely manner, and so that nobody got missed. Engagement-wise, I have been a part of the Virginia Nurses Association, and I like to join the online webinars that discuss things, like patient advocacy, or, getting up-to-date stuff that's happening in the nursing field. And then this reflects core nursing values, because, we're going to provide expert guidance to our patients. And how are we supposed to provide expert guidance if we are not up to date on what's happening and the newest things that are coming out? So we have to continually be learning, and you can do that through organizations and continuing learning things, even with advocacy on policies and state videos. I attest that this professional role and practice reflection activity reflects my own authentic work. AI tools were not utilized.